Thank you so much for this invitation. And we've been doing this course for the last 4 or 5 years, and it's always a pleasure to be part of it. So quickly go on to after listening to all this FRCS, ICO fellowship. What is it? What is the path that I would take, or how do I decide after my training? Should I pursue a fellowship? Should I write any other exam? As a career choice, should I join a trust hospital, corporate hospital, start a private practice? So these are the general options that we have once we are at the end of our training, be it the residency or fellowship. So the first question, and I think this was emphasized by KP and the other speakers as well, is to ask yourself, what is the present status of training? And you also have to understand that with this last 1.5 years, COVID taking away a lot of your clinical and surgical time, this question has become even more important. There are guidelines which have come from CFMG, from the US board, which lets you objectively evaluate the current status of the training. But as far as we are concerned in ophthalmology, you need to ask yourself, can you do cataract surgery? Can you handle all the complications of normal cataract surgery? And are you aware of the potential complications of a little deviation in cataract surgery? Or let's say you're dealing with a cataract with pseudoexfoliation, do you know how to handle it? So if the answer is yes, you know that the surgical part for a comprehensive ophthalmology, you have reached there. The second part, and KP again emphasized it, is your OPD skills. Are you able to do good refraction? Are you able to manage all the common conditions that you will see in your OPD? And at the same time, are you able to have your antenna up for the red flags during your routine OPD to make sure that you don't miss out on something which might be serious but coming with an innocuous presenting symptom? So if the answer again is yes, that you know that your comprehensive training has been fine, you have achieved what you should be achieving as a resident, then the question comes in, should you go for fellowship? And if so, what fellowship? I mean, obviously the favorite with a lot of people would be either cataract, cornea, cataract refractive, or retina. We have now great institutions offering this training all across India, and the training standards are very high, almost in all these institutions. Then there are other avenues as well, because the title of the talk is thinking beyond. So what about, let's say, a fellowship in UVR, neuro-ophthalmology? Obviously, these kind of specialties offer you a good intellectual satisfaction, because you have to work up each patient is a different patient, and you spend a lot of time to come to a conclusion about what is really affecting the patient. And both these specialties also offer a window to the body, because a lot of the disorders that we deal with here would have some connection with something going on in the blood or central nervous system or rheumatological system. So that way it is satisfying. But obviously uh, uh, these specialties have also become dependent on investigations and a financial aspect, a practical aspect. Employability, as Krishna Prasad mentioned, also is questioned. So in other words, the hot favorite fellowship programs are already sought after, and then there are avenues to pursue some of these offbeat specialties as your career choice. What about starting the job or working? Where would you like to work? So if your mental map, and this is just a representation, looks like this, where you belong to a non-metro city, or you want to settle in a non-metro city, and money forms an important part of your thought process, then private practice would be a good way if you know that your training allows you to go into practice directly. While if you want to settle down in a city or a metro, the money forms an important part of your thought process, then a corporate hospital, again, if you're well trained, would be a way to go. But if money is not the most important factor in your thought process, and you also would like to derive like satisfaction, academics, research, then a fellowship and a job in an academic environment is what you're looking for. What about other exams? FRCS, Devendra and Rohan have covered this beautifully, but you need to also make sure that if you're writing these exams, and as we discussed during the question answer session, you need to make sure that you listen to examiners' instruction to you very carefully. and make sure that if in a non-COVID era, when you were dealing with a patient, you need to make sure that the patient's comfort is of paramount importance. These exams let you concentrate on vision-threatening and life-threatening problems which can be associated with an ophthalmic condition, and it gives you an insight into an applied knowledge. How do you use these FRCS exams? Well, it is now you can register with MCI as a postgraduate with your FRCS exam. And in India, probably you will gain some advantage if you are applying for fellowship in an institution, because it tells you that it tells the interview board that you have inclination towards pursuing academics. In Singapore or UAE, now the rules have changed. A lot of these exams, unless you have a training in UK or US, they don't offer you as much advantage as it used to offer, let's say, 15 years ago. So we've talked about private practice, medical college, institutions, corporate hospitals. These are the way to go after your training is over. A private practice is also a very satisfying and a good platform because you have complete control on the processes, the way you want to set it up, how you want to treat your patients, and on your time. But you need to also understand that the present day private practice is a 24 hours job, at least in the first decade, and you require a lot of capital money to start the practice, because it's a now equipment and technology driven practice. The good point is that there is a lot of money which is floating around. If you have a clear-cut idea as to how you're going to start a practice and develop it, you will have support from banking institutions, non-banking institutions, and even venture capital if you have big ideas. So ultimately, finally, when you are planning your future, it boils down to what excites you. And would give you some examples, and a lot of these examples are part of our course today. Let's say, for example, Devendra, who has always been in academic environment, but now he's building an institution in a private practice, completely in a non-institutional space. But he still keeps in touch with his passion, that is academics. He conducts all these academic programs, even in his private institution. Similarly, Akshay, who is our co-faculty, was always interested in oculoplasty, always interested in publication. And at each point in time, at each milestone of his career, he never lost sight of these two. And he used his ecosystem. And currently, with mucormycosis, he has done such a wonderful work. He has dealt with so many patients. And I would just like to highlight one tweet which I came across on Twitter, where some random patient required an amphotericin B injection, and look at the people who he has tagged in his tweet. He has tagged Madhya Pradesh Chief Minister, Prime Minister of India, AIIMS, and Akshay Nair, because he, through the social media, realized that he's one of the person who is dealing with amphotericin B in a big way. Look at Dr. Rohan Sawant. He's very well trained, extremely good in his clinical skill, and then he wanted to try out something else. And his adventure, the spirit of adventure, took him to Ethiopia. He worked with us in Ethiopia. He built an institution there. He ran it beautifully and successfully, while never lost sight of his primary goal, which was to pass the Royal College exams. And while he was working on absorbing that new culture, he also continued to work on his main focus, passed his FRC off, and now he is in UK doing very well. So in other words, there are these real life stories where if you know what excites you, and if you follow that lead, in most instances, you will be successful. Thank you so much.